Hi friends, today we're talking all about biostimulators, which are quite an interesting thing. When patients come into the clinic, they don't often ask specifically for a biostimulator, which I think is a little bit unusual. They'll normally ask for a hyaluronic acid or maybe Profilo. They're the most common things that we hear, but not that many people come in asking for Radiesse, Sculptra, Ellanse, and these are going to be the products that we cover today because I feel like they just don't get enough love. I'm not really going to be discussing hyaluronic acid today. I'm going to make a separate video all about hyaluronic acid injectable moisturizers or biostimulators, if you like. Instead, I'm going to be discussing the non-hyaluronic acid products. So, to give you an overview, that would be poly-L-lactic acid products like Sculptra or Lanluma, calcium hydroxyapatite products like Radiesse or HarmonyCa, polycaprolactone products like Ellansé or Gouri. These products are all available in the UK, and I tend to use a mixture of them in clinic depending on exactly what it is that I'm trying to treat. They all have their own unique foibles or personalities, and we use them for different things. In this video, I'm going to talk about these products specifically as biostimulators, not in their volume filling capacity. Because of course you can use, for example, Radiesse along the jawline to create a more structured and crisper looking jawline, but you can also use it hyperdilute in order to give collagen stimulation and improve skin quality. Sculptra has been around for a really long time. It was first approved in 1999 for the treatment of HIV lipoatrophy.
Researchers are now studying blood and other samples from the victims, trying to learn what is causing the disease. So far, they have had no luck.
Hi, I'm Keith, and I've been HIV positive since 1985. So I'm one of those survivors. I'm leaning up against the building where I'm about to go in and get a Sculptra treatment. Sculptra is something I've done several times over the years, which has helped with facial wasting, which is a result of medications from HIV.
It's basically when patients who are on antiretroviral drugs, they get atrophy of the fat in certain specific places on the face or body. It's redistribution of the fat, and it gave this kind of characteristic sort of skeletal and quite gaunt look. And interestingly, this treatment was available on the NHS. So that's actually how quite a lot of the nurses back in the day became very good at performing Sculptra injections, was because they were doing it in the NHS as their day job. What was most interesting about Sculptra at the time was its very long mode of action. So it's been shown to be effective for up to 25 months. The fact that the results from Sculptra took longer to achieve was considered actually to be a good thing because it would then avoid overcorrection in patients. More recently, it's been used for large volume augmentation, and the most common area that we would use that would be somewhere like the buttocks. Lanluma actually has a product which is specifically for use on the body, and the vial is much larger than the regular Lanluma vial, which is in turn larger than a vial of Sculptra. A recent survey has shown that 42% of all poly-L-lactic acid treatments are performed on the buttocks. So I guess it's kind of important to have a nice bum these days. Weird that it used to be an insult, actually, didn't it? Oh, look at the size of her ass, they used to say. When using poly-L-lactic acid as a biostimulator, the only difference between doing it more for volume and biostimulation is the dilution of the product. And that's something that is determined by the injector performing the treatment, because both Sculptra and Lanluma come as a powder, which are then reconstituted prior to use. The time of reconstitution varies, again, according to the injector and the protocol that they are using. It used to be that we would have to dilute the Sculptra at least 3 days before the treatment was performed. It was thought that this pre-hydration would help to avoid nodules and granulomas. However, more recently, the manufacturers of Lanluma have advised that they are happy with same-day dilution. I'm still quite old school, so I like to dilute mine 3 days beforehand. One of the things you hear time and time again about these biostimulators is, oh, they stimulate collagen. And you kind of think, well, okay, this one stimulates collagen, that one stimulates collagen. What's the difference between all of them? Why should I use one rather than the other? Like, clinically, what difference does it make if you use a Sculptra or you use a Radiesse, for example? And it just kind of sounds a bit like a made-up marketing term, doesn't it? But I can tell you that it does make a difference which one you use clinically. They do all look very slightly different. They give a different result. Until quite recently, nobody has really known how poly-L-lactic acid stimulates collagen. However, in this recent paper from 2023, basically you increase collagen synthesis by stimulating the adipose-derived stem cells to secrete transforming growth factor beta and fibroblast growth factor, which leads to increased collagen synthesis. So you're stimulating processes that cause you to produce more collagen. But each of these different materials will do that in a different way. And this is why we suggest to patients, for example, that if they're using a hyaluronic acid biostimulator like Sunakos or Bellaterra Revive, that they alternate that by using nucleophil or nucleodin, so a polynucleotide, because they will act on a different receptor. So the difference between the Sculptra and the Lanluma, apart from the size of the actual vial, is the particle size. Lanluma particles tend to be a little smaller than the Sculptra. Does this matter? Personally, I find it a little harder to get the Lanluma out of a cannula. It feels almost a little more sticky, even when it is more diluted in comparison with Sculptra. Does it make any difference clinically? At this point, I'm not really sure that it does make a difference. I would select Lanluma if we were doing a part of the body rather than Sculptra, just because it's more cost effective for the patient. Next up, we've got calcium hydroxyapatite. You might be familiar with the concept of using Radiesse, which is calcium hydroxyapatite, hyperdiluted using saline in order to use it as a biostimulator rather than as a volumizing filler. The volume of dilution depends on the anatomical area to be treated. If your dilution is 1:1, it will still retain some volumizing properties. If it's more than 1:2, it's really more of a biostimulator. There have been some consensus guidelines published on this, which I can link for you. Like Sculptra and Lanluma, the hyperdilute Radiesse can be used both in the face and in the body. On the body, the most common areas to treat would be the neck, the chest, the upper arms, the abdomen, the buttocks. You could even do areas which are slightly dimpled or rippled as a result either of previous liposuction or sometimes even cellulite. When using calcium hydroxyapatite, there are two different types of collagen produced, type 1 and type 3. Type 1 is the type more associated with positive mechanical properties of the skin, rather than type 3, which tends to be associated more with the fibrotic processes. So essentially, type 1 is more supple than type 3. Interestingly, a paper has shown that calcium hydroxyapatite will cause production of more type 1 collagen and elastin than hyaluronic acid will. One of the frustrations when discussing biostimulators like Radiesse, HarmonyCa, Sculptra, Lanluma, etc. is, although the result is very good, I think people are often quite cautious about using them because they like this perceived reversibility of using a hyaluronic acid. So, with hyaluronic acid, you just inject an enzyme and it's gone again rapidly, whereas there isn't this same kind of antidote to using these biostimulators. So you do kind of have to get it right first time with these products. Nevertheless, I myself am happy to have them used. I've used them many times before, and I've always thought that the result was good. But it is therefore important that you see somebody who's got experience with using them in this fashion, and that you follow the instructions. So if they say you have to massage this afterwards, you definitely have to massage. HarmonyCa is the latest product from Allergan, the manufacturers of Juvederm and Botox. They actually bought it off an Israeli company. It used to be called Luminera, and it's a mixture of hyaluronic acid and calcium hydroxyapatite. I think it's quite good. You tend to use it in the submalar region on somebody who has got vertical lines here, or maybe on somebody who's a little bit slimmer and more gaunt. It's good because it gives you an immediate revolumization from the hyaluronic acid, but then over time you will see that the skin quality in that area also looks a little better. It's different to using a regular hyaluronic acid there, because you need a little more patience when it comes to getting the biostimulation, but I would say that the result is ultimately greater than that which would be achieved using the hyaluronic acid alone. The HarmonyCa does have a higher price point than regular hyaluronic acid, as you can probably imagine. I mean, I guess it's the same for the Sculptra and the Lanluma also. Just as a side note, I've been using a toothpaste with calcium hydroxyapatite in it myself, rather than a fluoride-based toothpaste for quite some time now, and that's also the latest thing in dental science. Calcium hydroxyapatite is a natural structure in the hard tissues of the body, so it's in the teeth, it's in the bones, and the idea behind it is that you will use this to remineralize the tooth rather than using fluoride. The last thing that I wanted to mention on the use of HarmonyCa, it's quite trendy on social media at the moment to say that fillers don't lift. There is actually a paper from 2021 which shows that they actually do, so check this out. Injections in the lateral areas of the face, like for example the temple, the mid-face, the jawline, have both localized volumizing and lifting effects in neighboring areas of the face, and this is something that I see day in, day out. I know that it works. And if you look at this section here, superficial temple injection gave a 17.5% increase in the lifting effect of the temple, plus a 100% increase in the jawline lifting effect, which is pretty mad when you think about it, because of course the temple is nowhere near the jawline. But again, this is something that I see every day, which is why I encourage patients to consider using filler in the lateral aspects of the face and treat what I would call the frame of the face, so the temple, the submalar area, and the jawline, because it will improve the effects of any treatment that we then go on to perform, for example in the marionette area or in the nasolabial fold. So suck it. Okay, so the third section now is polycaprolactone, and here I'm talking about ellanse and a newer type of injectable biostimulator called Gouri, which is Korean. Polycaprolactone is in the same group of polymers as PLLA, so Sculptra and Lanluma. However, it has a much slower rate of degradation. As an aside, the types of threads that I would normally use, Aptos and also Nordyx, contain a combination of both PLLA and PCL together. And the Aptos also has additional hyaluronic acid in there too, which helps to decrease inflammation once the procedure has been performed, which increases the recovery speed. Silhouette is only PLLA, and I used to use this type of thread quite a lot previously. Now I don't really use it at all, haven't used it for many years. I found that it's very easy to snap, actually, when you're placing the thread, which can be quite frustrating. And I didn't feel like it gave as much lift, which could have been the shape of the thread, in comparison to Aptos, which has a completely different shape. Similar to both the poly-L and also the calcium hydroxyapatite. The PCL causes induction of collagen type 1 and type 3. Like the other types, it also seems to be initially a slightly higher amount of type 3, which then transforms to type 1. So they all kind of do a very similar sort of thing. I don't actually use ellanse in the clinic, but I do use Gouri, which is it's a thinner format of PCL. It doesn't give volume. It is just a biostimulator, whereas the ellanse, you would use it more like a traditional filler. One of the things that you have to be aware of when using PCL is sometimes people can be a little more reactive to it. So if I'm using Gouri, we ask the patient to use an antihistamine prior to treatment and after treatment as well. Otherwise you can end up with a big swollen face like I did when I had it the second time. The result is very good though. So the result was arguably better on myself with the Gouri than I have experienced when having a Sculptra or Radiesse. So sometimes you do have to ask yourself, is the juice worth the squeeze? And I think in this case it was. That might put some people off having the treatment. The other thing is you do have to be very careful when having an injection with PCL, because if there's bruising at the time of treatment, because of the nature of the product, the bruise can hang around for much longer than it might do with a hyaluronic acid. So the use of cannula when performing a treatment like this is mandatory. The PCL is carried in a carboxymethylcellulose carrier gel, and it has this sustained effect because it's got this unique scaffold formation with the microspheres of the PCL, and the collagen stimulation takes place around these microspheres. Originally, Ellanse came as an S, M, and L format, which were lasting 2, 3, and 4 years respectively. More recently, the L has not been available here. Not sure why, they just seem to be focusing more on promoting the S and M subtypes of Ellanse. So why would you use one of these biostimulators rather than, say, using, Sunakos, Profilo, Belotera Revive? It's a great question. One of the hyaluronic acid containing products will give you this much more immediate hydration and kind of glossier effect to the skin, whereas the biostimulators give you more of a dermal, deeper kind of result. So they are quite different, and some people like to layer them. So it might be that maybe you would do a biostimulator, but then you'll put some hyaluronic acid in over the top. I tend to reserve them more for what I would call my expert patients. So those who are pretty au fait with having treatments done, who maybe wouldn't be nervous about the lack of reversibility of these products, because we know that the risk of side effect is extremely small, and they are happy to take that very small additional risk when having a treatment done. So for them, it's worth it. Likewise, if they're looking to see an improvement in a wider area of the body or skin, so say, for example, you're trying to do a whole thigh or a whole abdomen, it can be quite expensive doing that just with hyaluronic acid, given the number of sessions that you will need to do and the amount of product that you'll need to use. It can be pricey. Nevertheless, of course, sometimes people do still choose to do the treatments with hyaluronic acid. So Profilo Body was invented for that very reason, Sunakos Body, ditto. But there's nothing to stop you from layering them, as I previously mentioned. So if you like this video and you'd like to know more about the hyaluronic acid type versions, I'm thinking to make a video about that as well at some point in the future. Thanks for watching.